It's indeed a pleasure to witness another ICHR and such a successful conference. And as always, whenever we have guests from outside, I take the opportunity to share a bit of the story of RMI, and I think that's what I'm going to do once again. Back in 1991, Hyderabad was a newly established township, very little residents here, empty plots of land. I remember playing cricket in these grounds and learning how to drive over here as well. There wasn't much here at all. And at the time, healthcare in KP really lagged behind the rest of the country. Patients had to travel to Karachi, Lahore, other centers, and even abroad to avail services which were commonplace there, but not available here in KP. Looking at this need, is our founder chairman, who is an eminent and a pioneer cardiac surgeon who served in Karachi for a long time, decided that it was time to give back. It was time to go back and do something for his home province and provide them the services that this province deserved and needed. Even then in the 90s, there were a lot of skeptics. They kept asking him, why not Karachi? Why not Lahore? Why not elsewhere? And his answer was always, why not Peshawar? This province and this city needs it more than any other place, because it was not driven by any financial feasibility which offered the maximum return. It was all fueled by a desire to give back and a desire to give the people of this region services and access to facilities that they were lacking at the time. So in the first decade when RMI commenced operations, and I'm delighted to see our founding CEO, Dr. Tanveer Abdullah Sahab, and he would recall that our first tagline or slogan was setting new standards in healthcare. And what we're particularly proud of is the new healthcare model that we give this province, that so many other institutions, both in the private and the public sector, have since emulated, and we see this all the time. And it really gives us a lot of pride to see that our contribution extends beyond just this campus or these premises, but the wider healthcare ecosystem. We're also very proud of the fact that many of these institutions here in KP and all over the country are now managed and staffed by RMI alumni being the individuals who've served in RMI in various capacities in the past. So what started as a very small hospital focusing on cardiology and cardiac surgery rapidly grew by the grace of the Almighty. And over the years, we've expanded into renal transplants. We've got one of the most successful renal transplant programs in Pakistan, alhamdulillah. We've got interventional radiology, a center for reproductive medicine, and a host of other facilities, both in the diagnostic and the therapeutic sphere. So that's what the first decade for RMI looked like. And very soon we realized that a healthcare facility is more than a brick and mortar facility. It's more than this biomedical equipment and nice infrastructure. Healthcare can only be delivered through high quality HR, and that is what our province was lacking back then. So the next decade, and the story of RMI can largely be broken down into decade one, decade two, and what we have right now is the third decade. So the second decade was all about capacity building and producing high quality healthcare workers, not just for our own institution, but for the wider community here in the province and really for the world. The Rehman College of Nursing was the first of 5 colleges that we've established since then, and a number of postgrad programs in a variety of disciplines ranging from cardiac surgery, cardiology, neurosurgery, gynecology, pediatrics, and so on. The undergrad programs that we starting with the College of Nursing, went on to expand into the Rehman Medical College, the Rehman College of Allied Health Sciences, the Rehman College of Rehabilitation Sciences, and finally the Rehman College of Dentistry, who are the proud hosts of this conference. So the high quality AHR that we have been producing over the years are serving not all over Hyderabad or Peshawar, but we're so proud to see them now serving in leading institutions all over the world.